All right, good evening, everyone, and welcome to a fresh episode of ATP Live Monday. ATP Live Monday is brought to you by Ask the Pediatricians Foundation, and it's an opportunity for you to ask any questions you may have about the health of your children and get an answer live for the next 1 hour. So, on whichever platform you're watching, whether on Instagram, I can see some of you on Instagram, or you're watching on Facebook, or you're watching on our YouTube channel. I want to say thank you so much for joining us and welcome to ATP Live Monday. I am Gbemisola Boyede. I'm a pediatrician and I'm the CEO of Ask the Pediatricians Foundation. Ask the Paediatrician Foundation is committed to the health and welfare of all children globally, especially in Nigeria, where majority of our children still die from preventable causes. So we're committed to providing health education information, and we also do community outreaches to places where people may not have access readily to the pediatricians. We don't want any child dying from preventable causes of death. And for those of you who are on Facebook or YouTube, you can see my background. On Saturday, this Saturday, 27th of May, is going to be our Children's Day. It's the Children's Day actually in Nigeria. And usually, as our custom is, we usually do outreaches. For the first time this year, we're going to do outreaches both offline and online. So just watch out for an outreach in your state close to you. And for those of you who have never had opportunity to meet with ATP pediatricians because maybe we've never come close to you, for the first time you have the opportunity now. You can join our outreach. You can book for our online outreach on Saturday, because our pediatricians, including myself and many other pediatricians and doctors, will be able to give consultation for free to children, and we're going to do like 10 minutes per child. So if you want to be part of that offer, feel free to register online. The link is, I think I'm just going to put the link for those on Facebook and for those on Instagram as well. I will put the link so you can just book your link, um, and we will get back to you. Just to say, we have very limited slots available, and so if you want to be part of it, try and book on time. So welcome to ATP Live Monday. I just said I should do the announcement first so that I don't forget. Um, if you're just joining us, please share the video. Let's share the video. Let's invite friends and family. I'm also going to do that. And after that, we can start. So welcome to ACP Live Monday. Feel free to drop your questions, whichever platform you're watching on. You can drop your questions, and I'll try my best to answer them in the next 1 hour that we have. Of course, if you are unable to ask a question during the live session, remember that you can always, of course, post your question on our Facebook group, Ask the Pediatricians, from Mondays to Saturday, and we will answer the questions for you. Of course, if you have anything that is an emergency, we don't encourage you to ask online. We prefer you go to the hospital for urgent and emergency issues. And ATP people tend to abuse the word urgent, emergency, everything is urgent, everything. So, from the medical perspective, urgent and emergency are something that you need to do something right now. Like you have to do something, or else somebody may die. So that is what is urgent. That's what's an emergency. So anything that cannot wait, please, you have to go to the hospital. But if you just want to ask questions about health issues, you want to be informed, education, information, they are never urgent. We can always do that. So for those, you can always post that on our Facebook group. I always like to give that clarification because people will come and say, oh, this is very urgent. I need you to answer this question now. Remember that all the pediatricians are working as well. So we are never online 24/7. We are in the hospital seeing children as well. So if something is very urgent, you have to come meet us in the hospital. Otherwise, you can always post your questions and then we will get to them when we have more time. Usually, as our free time, we can always address health issues, education issues, and all that. So, thank you so much for joining me. We appreciate you for joining us. So, start to um, put your question now on whichever platform you're watching from, and I'll try and answer them as soon as possible. I'm just sharing the videos to all our other platforms so that everybody can see. So please start to drop your questions. I can't see any question yet on Instagram. Start to drop your questions. Instagram, YouTube, Facebook, drop your questions. And please share the link, share the video so that other people who may want to ask questions, they can see it and they can ask their questions. Thank you so much. I think I'm almost done. 1 minute just to make sure I pin the videos and then we can start answering the questions. And don't forget our outreach coming up on Saturday. It's this Saturday. You just have 7 days, less than 7 days actually. I think we will soon close the application. And so it's going to be limited spaces. So the earlier you get in, the better. And it is first come, first serve as usual. And remember, it's 10 minutes consultation, so it is just a quick one. So if your child has a long-term health issue, something urgent, again, emergency, that is not something you book for, but you will still talk to you. But if something, you will advise if you need to go for hospital admission, and that will advise you. But things like that is best to go to the hospital for. But things that are non-urgent health issues, that's a great opportunity for you to speak to a pediatrician for free. And that consultation is worth nothing less than 25,000 naira for most places in Nigeria. And in some places, it's worth lots more. So, but we are giving to you for free as part of our celebration of the Children's Day. We celebrate our children, we love them, and we want to make sure that all our children are healthy and healthy. All right, I think I've shared all the videos myself now, so I'm good to. Let me just check the ATP zone is pinned as well. Yeah, I think it's yes. Okay, so I'm good to start taking the questions now. So welcome to ATP Live. Ask your questions, and we will try and answer them in the next 1 hour. I have put the link for those of you who are watching, whichever platform you're watching. I'll put the link for you if you have not booked your consultation for free on this Saturday as part of the Children's Day. Please click on the link and book. And please remember that if you book, you must attend. It is free, but don't waste somebody else's opportunity. So if you give you an appointment, please make sure you attend so that if not, other people should have used the opportunity. If you don't, we may take note of your name so that next time we have opportunity, we'll make sure you don't get it. So try not to book if you know you're not going to be available, to make use of the opportunity so that we can really, really attend to those who really need it. And if you don't need it, there's really no need to book one. Of course, we'll have our health talk on Thursday as part of the ACP hour, and on Saturday we'll be having a free consultation. And there are also outreaches going on in many states, in Oyo State, in Abuja, in Anambra, in most of the states of the country. There will be outreaches. Not everybody will be doing the outreach this Saturday. Some will be doing their own outreach in maybe a few other Saturday. For the whole of May and June, there'll be outreaches in different communities in Nigeria. So also watch out for our offline outreaches. But for the online outreach, it's going to be this Saturday, which is actually the Children's Day. And so make sure you book if you need that. All right. So welcome to ATP Live Monday. I can't seem to have any question yet. Okay, I have one question from Facebook. So we'll start. Somebody say, please, my 13-month-old daughter contacted chicken pox. What do I do? All right, thank you so much for that question. Chicken pox is a viral infection. That means it's caused by a virus, the chicken pox virus. And so the good thing about most viruses or infection caused by viruses is that they don't require any specific drugs or treatment. They tend to run their course and they will go away. So there's no specific drug itself for treating the virus or the infection, but we give what we call symptomatic management. When we use the word symptomatic, it means we try to make the child comfortable. We deal with the symptoms that the child is having while we are waiting for the virus to clear itself out. So for chickenpox, most of the time the children have all these rashes, they have fever, and they're itching and all that. So we address each of those one by one. So for the fever, we give paracetamol. So you can give your child paracetamol. You can give paracetamol every 6 hours. Okay, based on the weight of the child, this 1-year-old child, 5 minutes of paracetamol every 6 hours will be okay to deal with the fever. You can also tap a sponge, that is, you put towel in normal or lukewarm water and then just rub it around the child. And as the child, as the water dries up, the child's temperature will go down. So that is how we deal with the fever. You can also give ibuprofen, but paracetamol is best and it's okay. Then you make sure the child is drinking a lot of water. And of course, for the rash itself, which is usually very itching, you can apply calamine lotion. Most mothers are familiar with that. So you use calamine lotion. The calamine lotion, it just gives that soothing effect. It makes the child feel cool. It reduces the itching. If the itching is bad, sometimes we can give something to reduce itching, like antihistamine and all that. Piriton, for example, is an example of an antihistamine. So that is how we manage chicken pox. Most chicken pox within 1 week would have resolved. Okay, but please make sure that that diagnosis is correct, because a lot of mothers tend to label rashes either measles or chicken pox, and that's it. But there are lots of other rashes, and so I always want parents to be sure first. So if you're not sure, it's better you let the doctor see the child and diagnose. But I think chicken pox is quite obvious. Most parents tend to know it. So that is how to do it. You don't have to worry or panic. It's going to resolve by itself. Usually within 1 week, most chicken pox will have resolved. You also need to try and keep the child away from older children. I know it's a little bit difficult now, because by the time your child is having rashes, it means the child has already been incubating the chicken pox, and that means the chicken pox, the child other children in the house may have been exposed already to the chicken pox, and so you won't be surprised if other children also start having the rashes. Well, it's not so bad. Most children will just have the rashes, and they'll be fine. However, if your child have like difficulty with breathing, or the child is becoming unconscious and all that, because sometimes it can there can be complications involving the brain, involving the respiratory system, and all that, then you have to take the child to the hospital. But if you just fever and the rash, you don't need to do that. What I just said is what you do: paracetamol, tap a sponge, apply calamine lotion, and within 1 week, most of the rashes will have cleared, and the child should be fine to go back to school. So I hope that helps. That is from Facebook. I can't seem to see questions on Instagram yet, so I guess everybody is happy. Remember, if you have any questions, try and put your questions quickly. I hope Facebook people can see me, and because sometimes Facebook has all this algorithm and people cannot see you when you're online. So feel free to post your questions and we will answer them. I think one question just dropped on Instagram. All right, just 1 minute. Uh, I'm just putting for his Facebook people because maybe they are not saying it. Okay. All right, I can see a question on Instagram. I need to bring my glasses out. So baby will be 8 months in 2 days. Exclusive breastfeed, still on breast milk. He has never accepted formula since he completed 6 months. He reacts and stop the milk. He vomits to high temperature. I'm just trying to see whether that's the beginning of your question. I guess that's the beginning. All right, so there's never a problem about a child not taking formula. It is not compulsory for a child to take formula. So as long as the child is on breast milk, that's fine. So that's what the milk the baby still needs for now. So, but breast milk alone is not enough. So the child should be on all the food. So is the child taking other complementary food? So if the child is taking other complementary food, it is fine. It is not compulsory that the child has to take formula. So um as far as the child is still on breast milk, that is enough and is a very good source of milk for the child. So the only thing is to make sure that the child is taking other complementary foods. And if you need more information about complementary foods, I mean, we have lots of resources on our Facebook group, on our website, on the podcast platform, on our YouTube channel. Just check any of them and put complementary feeding into the search button, and it will come up with a lot of articles or our videos and all that, so that you can learn more about complementary feeding. Because if you start talking about complementary feeding, that's all I'm going to talk about today. So, but there's no reason for you to worry about a child not taking formula. Some children don't. Some children react to certain formula because most of those formula are made from cow milk, and some children have what we call cow milk protein allergy, so they may react to the protein of the cow. So your own breast milk is human protein and it's okay. So just keep giving breast milk while you had other food. So there's no reason for you to worry at all. All right, thank you. The next question I'll take from Facebook. Um, a Facebook user, I think somebody was watching on our Facebook group, say my son of 3 years and 6 months is having body itch. It comes and goes within 3 seconds. Why doing that is cream, no rashes, just itch. Okay, that's a little bit unusual. So if a child is having itching and all that, the first thing that comes to our mind will be, maybe is it an allergy? Is the child reacting to something, especially if it's something that is just for a few seconds? But then most time for allergy, you tend to see something. You may see a rash. It may disappear quickly as well, but usually it comes up with like something like a little bit of a red swelling or something, but it may just disappear as quickly as possible as well. But the most important thing anyway is to know, why is this child itching? That is the most important. What is the child? What is causing the itching? Is the child reacting to something? Sometimes you may have to just pay attention as a parent to figure out what are the things that normally happen before this episode happened. So you may need to pay attention. And even though you describe it as a itch, is it a itch? Is the child really scratching the body? Because because you said the child just scream. You didn't say the child is scratching and all that. You just said it comes and during that it screams. Is he scratching his body and all that? And after doing the scratching, are there things that you can see? So you need to give better clarification, because there are other things that a child can have that looks unusual and abnormal. Sometimes some children are actually having a convulsion, and it is not every convulsion that the child is checking, and sometimes some convulsion comes as an unusual behavior. So it's very important that what I recommend is that you do a video recording of this particular episode and take note of how often it's happening, and then show it to a pediatrician and also discuss with the pediatrician, because there may be more questions that they need to ask you, and then that will help us to know what is really going on. So if it's something that happens recurrently and all that, then it's very important for us to know what is causing it and how we can address it. So that is very, very important. All right. Next question from Instagram. Um, Still the same beauty clinic. It said he accepts homemade food. Good. We'll go to other platform to get more information. All right, you're welcome. All right, so I'm happy as long as it's taking homemade food, that's fine. So your breast milk is still good. You can actually express your breast milk and add it to the pap or whatever you want to add milk into. The breast milk is a very good source, and you don't need to you don't need to panic, worry that the baby doesn't take formula. No, there's no reason at all. All right, so welcome everyone. If you are just joining us, you're on ATP Live Monday. ATP Live Monday is a platform of Ask the Pediatricians Foundation, where you can ask any questions about the health of your children, and you can get an answer in 1 hour. So we try as much as possible. And of course, if you have any question beyond our live session, remember that you can always go to our Facebook group and you can ask your questions there. Many people always ask us on Instagram, especially, can I ask my question here? Can I ask my question? No, but you can't ask your question on Instagram for several reasons, because Instagram platform is not designed for that. So I know most of you will say I'm not on Facebook, I'm only on Instagram. Unfortunately, because Instagram is a one person use kind of a thing, and most of people that are handling our Instagram are not the doctors, so they are our admin staff, so they cannot answer your health issues. But on Facebook we have the doctors there, and each doctor can always answer questions, and we have several professionals and moderators, and when we have opportunity to approve question and answer question and close it, so that we don't get a lot of confusion and all that. This is why Facebook group is a better platform compared to Instagram. So apologies to the Instagram people, but of course ATP Live is an opportunity for you to ask your own questions and get your answers live. And I just want to remind you again that our Children's Day outreach is happening this Saturday on the 27th of May 2023, from between the hours of 9 to 5 p.m. We have a lot of our doctors who have already signed up, who will be consulting for us. So if you want to see a doctor one-on-one, so this is a once in a year, or maybe once in a not every often kind of opportunity for you to have a free consultation with ATP doctors, ATP pediatricians. So I will say grab it with both hands and make sure you book online. I've put the links on Instagram, on Facebook, it's everywhere. Just book, because we have limited spaces and we may soon close the registration platform. So the earlier the better. So if you have not, it's an opportunity for you to sign up for the Children's Day outreach. All right. Okay, so seems today no questions. I don't have questions from Facebook. I can see many people are watching, many people are listening, but everybody seems to be fine. That's fine. We pediatricians, we are one of those people that we don't mind, like, we don't want the children to be sick. Actually, we actually work harder at making sure that children are not sick, and people wonder, how will you make money as doctors, as pediatricians, if the children are not sick? Because there are lots of what we can still do with our children even when they are not sick. We still do our routine check, we monitor their weight, we monitor their immunization. There's so many things pediatricians can still do for healthy children even that are not sick. So it is fine for children. So we are happy when the children are not sick, or rather they are well and doing fine. So that's great. All right. So thank you so much for those who are watching us. And remember, we stay here. If you have any questions, you can ask your questions. Again, since I still don't have any question now, so I'm just going to use this opportunity to give a little bit of some free health promotion and talk advice. Basically, based on the number of questions that do come on our Facebook group, I tend to know what is going on. And I think for those in Nigeria now, there's a lot of rashes. Children are coming down with lots of rashes. We get pictures, hundreds of pictures every week of my child has this rash, what do I do? My child has that rash, what do I do? So usually for those of us who live in tropical environments, we tend to deal a lot more with what the bacteria, because the bacteria, they tend to thrive in warm, humid environments, which is what you get in tropical climates. So it is hot, it is humid, the bacteria love it. Unlike people that live in dry, cold places, the viruses love those ones. So that's the difference between the two areas. So when our weather is a little bit hot and dry, or humid, we need to be very conscious and very particular about the hygiene around our children, because the children will sweat a lot, and most of them, they touch things, they touch that, they play with the football, throw it, touch this, touch that, and most of the time in that process they're having a lot of germs, bacteria on their hands, and then they touch their body, they touch their faces, and that is how they introduce those germs. And like I said, the bacteria, they love that kind of environment. So the way to get rid of it, you can't really stop children from not playing, you can't stop them from not contacting the bacteria, but if we get used to washing their hands often, then it is very easy to get rid of those bacteria. Most of them are very weak, actually. So hand washing is one of the most important strategy in dealing, in preventing some of these infections. So, and I know children don't remember to wash their hands. So we need to make sure that we wash our hands regularly, Okay, apologies everyone. Uh, my internet went off. I think my phone was overheating, so I just fixed it. My sincere apologies. Thank you so much for your patience and for coming back. Thank you. Sorry for the breaking transmission. Okay, I think I was talking about um the skin rashes and all that before my phone went off. I was just trying to encourage us to make sure that during this period we maintain good hygiene for the children. Let's encourage them to wash their hands. Once you catch them, just go and wash your hands. When they come back from school, wash their hands. Let them change their clothes daily. Sometimes children they just like certain clothes, they want to wear it all the time. They've sweated into it and all that. So when they wear it again, it's easy for bacteria to feed on those to live inside those kind of hot, humid environments. So we need to encourage them to wash their hands, wash their clothes daily, and we need to we don't have to wash your clothes daily, but at least they should change it daily, especially the inner ones, the vest, the pants, on the waist. Generally, we need to encourage them to do that. So these are the ways by which we can protect our children from all these rashes. Let's avoid using products that have too much of chemicals. So if I know some of you think using medicated soap is good and all that, but most of the time there are what we call good bacteria, good that we want on the skin. So when you use medicated soap, you clear off the good ones, then it make it easier for the bad ones to come. So there are what we call the normal flora, good bacteria that normally are on the skin, and when they are there, they prevent the bad ones from causing infection. But when you use medicated soap and all that, you actually clear them off, and then you make the child more prone to having the bad bacteria or germs multiplying on the skin. So normal tablet soap will be fine. Normal, even the black soap, and they are fine. So avoid so much of medicated. So unless it has been prescribed by a pediatrician or a doctor for usually for a short duration of time. Also, let's avoid using all these chemical products, all these products that have too much of chemicals in them. Let's avoid using them on the skin of our children. Go for something that's natural, like your shea butter ori, like your coconut oil, your petroleum jelly. Things that are natural, they're actually better in terms of skincare rather than using some of these nice smelling but too much chemical in them products or for the skin of our children. So these are like basic things we can do first, and that will help our children. And then just the hand washing and general hygiene, that will be good for most children. So I just say I should put that in because I've noticed a lot and lots of questions about skin rashes, and most of them, when I look at them, they are bacterial infection. There are lots of, once you start seeing things that look like pus on top of the on top of the in the rash, like something that look like water with, that is most of the time bacteria. Also, children are prone to heat rashes as well during this hot, humid period. So try and make sure that you keep the children cool. Let's open the windows. Let fresh air blow in. Using fan does not make the children cool. The fan is just a circulating kind of device. Is supposed to circulate air, bring in old and bring in new, and take out the old. So if you don't open your windows and you're using fan, you're not doing it properly. So there must be ventilation. So there must be at least one or two windows open and the fan blowing, then there'll be ventilation. But if you are using the AC, yes, the air conditioner can take in, the proper one. Some of them can even clear out bacteria. They have all those filter and all that in them, but you have to make sure you also clean them up and there are no dust trapped in them and all that. So these are the time that we really need to pay attention. All right. Okay, I don't know why I'm not getting questions from Facebook. I hope people can see and they are dropping their questions on the right link though. So please drop your questions on the right link. Um, okay. So that is just about rashes. Okay. Thank you so much. Sorry that I break up, but if you have any questions, feel free to ask your questions and we will answer them. We still have about half an hour to go and we will try and finish in by 7 p.m. So there's still room for you to ask any questions that you may have about the health of your children. All right. And for those of you who are just joining, if you didn't hear my announcement before about our um, outreach coming up this Saturday, feel free to let me put that on Instagram because I think the last one was Elizabeth. Feel free to uh, click on the link and then ask you, and you can book to have a free 10 minutes consultation per child this Saturday. Uh, as part of ATP celebrating the Children's Day outreach. So, we want to celebrate with those of you who are our online members this time around. But for those of us in the States, there are um, there are outreaches also in states like Kwara, like Oyo. Many states are doing outreaches, so you watch out for those outreach. And if you want to know the details, I think we have the flyers on our Facebook group, so you can know where it's happening locally around you. Maybe somewhere very close to you, Abuja, Gombe, Anambra. So many states having their local outreach as well. So feel free to join in and be part of that. So it's our one of the things we do. We do two outreaches every year, May and October. So May is the Children's Day outreach and October is the Independence Day outreach. So you're welcome to be part of our outreaches. Thank you so much. All right. Today's a good day. I don't have so many questions, which is quite good. That means all the children are doing well. All right. And just to remind those who may be watching this after the live session, because sometimes some people will come after I've closed by 7 and then they drop the questions still on the video. Unfortunately, at that time, I won't be able to see the questions because we're no longer live. So if you come after live, if you are watching this and you're not watching it live, don't worry, you can still ask your questions. All you need to do is to go to our Facebook group. We have 4 Facebook groups actually, but if this is about children health, then you go to ask the pediatricians. That is where you can ask questions about the health of your children on Ask the Pediatricians Facebook group. If you want to ask about adult health issue, pregnant women, infertility, all those adult health issues, please go to ATP Family. We are very particular about where you drop your question because we have different level of professionals in different platforms. So we want you to put the pediatricians questions on Ask the Pediatricians and want you to put the adult health questions on ATP Family. If you have lost a pregnancy or a child and you need that moral support from other members of our community who have gone through the same challenge, you will get that on our ATP Still a Mom Facebook group. So you can go to ATP Still a Mom, and if you are a first time mom, I have a Facebook group for first time mom, FTM Baby Care. That is where you can get that, and you can also get information about all our products on FTM Baby Care. That is especially for first time mothers because I really have a passion for first time mothers, to help them navigate motherhood, especially in our world that is becoming more and more complex. A lot of women don't have access. Most of the grandmothers are working themselves. They're executives and professionals, so they don't have time to come and do mugo. So you need that support, and that's why I produce a lot of products that will help you to navigate your first time as a mother confidently, calmly, and without any tears. So if you are interested, the FTM baby care group and the FTM products are for you. All right, I got a question. Whew, I got one question finally. Somebody said my 7 months old is yet to crawl or sit. She can sit with support. She rolls while sleeping. Should I put her on her tummy to make her crawl or sit? Okay, thank you so much for that question. Number one, it is not the positioning. It is not where you put the baby that determine whether the baby will sit or crawl. So it has nothing to do with that at all. So when it comes to developmental milestones, there are ages which we expect a child to be able to do certain things. So crawling is definitely not a 7 months old thing. So you shouldn't be worried that your baby is not crawling at 7 months. Nobody is worried about that. Most babies crawl around 9 months. Okay. And even some babies never crawl. Some babies do what we call bottom shuffling. They move with their bum, and some babies don't crawl. Some babies just don't bother. So crawling is not even, should not have been part of this question, because the baby is not yet at that age where the baby should even be crawling at all. Okay, so let's take out the crawling. So but the sitting, your a 7 months old should start sitting without support. So usually it's between 7 to 8 months we expect them to start sitting without support. So your baby is just 7 months old. So I would just say give the baby a little bit more time, because some children are just a little bit slower than their colleagues, but there's nothing really wrong with them. So I would say just let the baby, give the baby a little bit more time. So if by 9 months your baby is not yet sitting without support, then I will be worried about the child, unless there are other issues about your child. Like for example, if your child already has challenges, maybe during when you were pregnant, or during the delivery, or after the delivery, maybe baby had jaundice or other problems that could, or baby was a premature baby or anything. If the baby already has reasons why the child could be slow, then I will not say wait. I will say go to see the pediatrician so that we can start early intervention, because we already expect that this child may be a little bit slower because of those reasons. But if your child is being otherwise well, normal delivery, normal everything, child has been perfectly well, just give the baby a little bit more time, and hopefully the child will start to do all these milestones. So don't worry and don't panic. All right, the questions start to come now, and they're all rolling in now. I'm struggling to know which one to start. So, okay, let's answer Facebook, then I'll come back to Instagram, people. So, somebody say, my baby of 3 weeks is always crying. That's all they do at that age, okay? And whenever he's sucking, we suddenly remove his mouth and start crying. That can also happen as well. Sometimes babies are very sensitive, especially the newborn babies. They are very sensitive to their skin, and everything surprises them. So even like a little bit of gas coming out of their body, they act shocked, like, is that from me? So that is not something to worry about at that age. So you don't have to worry. You just fetch the baby and put the baby back to breast. My breast is always soft. Okay, your breast is not meant to be hard anyway. So I feel it's not getting enough breast milk. Okay, that is not how we know the baby is not getting enough breast milk. So there are many things mothers use as their own way of deciding whether the baby is getting breast milk. Mothers worry about my baby is always crying, or my baby is always sucking, or my breast is always soft, or my breast is not like hard and overflowing. Those are not the pediatrician's way of deciding whether a baby is getting enough breast milk. The way we know whether a baby is getting enough breast milk, number one, we can actually ask to press out the milk. Press it out. Let's see the quantity that the baby actually. So sometimes some mothers will press out the milk, and the baby is taking 200 mils of breast milk. And so if your baby at once, that means your baby is getting enough milk, no matter what. All these symptoms may still be there. So if you can see the quantity of milk, because when baby are sucking directly, you don't see, you can't measure. But if you want to know, you can actually press out, see how much, and you can Express, let's say you express 100 or 120 or 150 and give the baby and see whether the baby still cry after that. Then you can be sure that, okay, so this baby actually gets enough milk. If you don't want to do that, the most objective way for us as pediatrician to know if your baby is getting enough breast milk is weight gain. A baby who is gaining weight is definitely getting enough milk. So that is what we use, not crying, not how many hours baby stay on the breast, not how whether the baby cry and remove mouth. No, those are very subjective things. Doesn't mean anything. So the most important way for us is to, so for your 3 weeks old, you can go and weigh the baby, in the hospital, or you can express your milk and see how much comes out. And but let me just warn you that your baby is going to definitely suck more than what you can express, because sucking is an active process more than expressing milk. So if you really want to be sure, express your milk and measure it so you see the quantity that your baby takes, and see whether when baby takes that quantity, baby is still having any issues. So for you're on our Facebook group, please go to our guide session and go to the very first guide is on breastfeeding. So there are a lot of breastfeeding videos. There's actually one on how do I know my baby is getting enough milk. So there's actually a video that shows you how you know whether baby is getting enough milk. So don't start to worry on, because see, what mothers do is that when you start to get flustered and worried and anxious, you actually start to reduce your breast milk supply, and then it becomes a vicious cycle. So you were unnecessarily worried that your baby is not getting enough breast milk, but that unnecessary worry and anxiety actually now reduce your breast milk. So you will now become justified, and then the next question you're going to ask Dr. Gbemi is, can I go and get formula and all that? So which is actually something that should, so relax. You got your baby, you can breastfeed your baby. You produce more milk than your baby needs. You can breastfeed exclusively even twins. So if you have a single baby, you got enough milk. You got more than enough. Relax, relax, relax. The secret to your milk flowing is just keep putting that baby to the breast. Make sure your baby is well attached to the breast. When your baby is well attached to the breast and your baby suck on the breast and you are relaxed, eating, no pressure, no stress, your milk will flow. Your milk flows from your brain, not from your breast, okay? Because milk production is based on hormones. Those hormones are produced in your brain. So if you are worried and anxious and everything, your brain is going to shut down milk production, because it's going to be producing what we call stress hormones instead of milk. But if you relax, you are happy, you see your baby, you carry your baby, you are happy, then your body will be producing more milk. That is why even when you are just thinking about your baby, you will start producing more milk. That is how it works. So breast milk production is a demand and supply, and is from the brain. The mother has got to be relaxed. You've got to be confident in yourself, and you just keep putting the baby to the breast. As the breast empties, more milk will flow in, and if you're relaxed. So if you watch all those breastfeeding videos, you will get it. There's a video on how to increase your breast milk supply. You've got all that. So that is what I'm going to tell you. But don't start to panic, because now you are going to reduce your breast milk supply. All right, let's go to Instagram. I'll come back to Facebook. Um, Avila, I guess. Good evening, ma'am. Thanks for all you do. Thank you so much for your kind words. Kemi Simon, please doc, explain tachycardia for children. Tachycardia is just a big medical jargon for fast heart rates, like your heart rate fast. Some call it palpitation, your heart is very by tachycardia. So the most important thing is what is causing the tachycardia. There are if you run, if you exercise, your heart rate will go up. So that is, you have tachycardia. If you if you're excited, you just finish taking coffee or something, your heart rate will go up. So there are things that can make your heart rate go up normally. But if you're at rest, you are sitting down like Dr. Gbemi is sitting down right now, just talking, and your heart is beating boom, 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 boom. then there's something is wrong because I've not run, I've not done any exercise. I'm just talking, I'm like leisure, I'm at rest. So my heart should not be too fast. And there's a way we count it. Okay, I'm not going to ask you to count it as a mother, but unless you use all these machines, all these BP machines, if you put it on your child, they can read the heart rate as well. In fact, most of the phones these days, most of these wristwatches, smartwatches, they can count your heart rate for you. And so there's a normal level of heart rate for children. Children's heart rates are generally faster than that of adults. So for newborn babies, it's even fastest. Newborn baby can their heart rate can go as high as 120, and all that. But for by the time they're older, we expect it to be less than 100. Okay, usually adults are less than 100. So if your heart rate is going over 100 and you are not doing an exercise, you're not doing anything, then that means the heart rate is fast, and we want to know why. There are many reasons why the heart rate could be fast. It could be fast in children with heart problem. It could be fast in people who have other issues, even respiratory problems that can affect the heart, because the two of them are kind of linked together. So if your child is at rest and you think the heart rate is fast, you have to see a doctor. We will count it ourselves. We will measure it. If we think it is faster than what we expect, and the child is not afraid, the child is at rest, the child is not anxious about anything, then we were going to be investigating why is this child heart rate fast, and then we're going to deal with it. So that is all I'm going to say about that. If you have very specific, I prefer people ask very specific questions like yourself. Why are you worried about tachycardia and all that? It's best to ask more specific questions about your own situation rather than ask general questions like that. All right. Then gift blessings. Say, please, doctor, maybe of 2 months and stool 3 to 4 times a day. That is perfectly normal. And we're on EBF, that is perfectly normal. They can stool up to 12 times a day. All right. I know you're worried about your pampers. No, not pampers, your diaper. So you're worried about that. So that is normal for them. As long as the stools are not watery, and watery for them looks like urine, like water, like completely sinking into the diaper. But if not, each time the baby suck, baby can pass too, and that is perfectly normal. There's nothing wrong. So 3 to 4 times is normal. It can be up to 12. Kemi, what can be done for an 11-year-old still bedwetting? Yeah, so if an 11-year-old is bedwetting, we want to know why. So there are different kind of bedwetting. We call it enuresis. We have what we call primary enuresis, which is a child who has never been dry. This child has been bedwetting all their life. Then we also have what we call secondary enuresis. That is the children who have stopped bedwetting before. Usually maybe by 3, 4, they've stopped bedwetting. Then for somehow, for no reason, they start to bedwet again. So these are we'll start with that. The causes of children who have never been dry before is different from a child who has been dry before and now start to bedwet again. So we need to know which one it is. So the best option is to see a pediatrician who knows about enuresis. So because it's not every doctor, it is not every pediatrician, because some people, even some doctors, behave like parents. So they think, oh, your bedwetting going to flog it out of you. Bedwetting is a medical condition, it's a diagnosis. So it's not something you flog out of children. All right, sometimes you can't flog it out of them. Some children have other reasons why they bedwet. Some children have medical abnormalities in the urinary tract. Some children, they cannot concentrate their urine, and because of that, they're always producing too much urine, and so the urine will come out no matter what. Some children are deep sleeper. They don't have what we call the arousal mechanism. The only reason why you don't bedwet is because something wakes you up, that your bladder is full and you need to go and empty it. Some children have what we call small capacity bladder. They any little thing, their bladder is already too full, and so they cannot keep urine for too long and they will bedwet. So there are many mechanisms and many reasons why this happens. So what we do as pediatricians who know about bedwetting is to figure out where this problem is happening and to support the child. And the good news is that enuresis is one of those things that we can actually treat, and the children can be better. So for example, the child is producing too much urine, we can give a drug that can reduce the amount of the urine, or or the help the child to concentrate the urine. We can use alarm if the child is sleeping too deeply and they cannot wake up. Sometimes use alarm. We have what we call bedwetting alarm. So once the urine start coming out, the thing start to ring and the child will wake up and go to the toilet, and within time they can get. So there are treatment for bedwetting. Unfortunately, it's one of those conditions that can give children psychological uh trauma, because they start, especially at this age of 11, by the time they're becoming adolescents, they start feeling very self-conscious about it and all that. So please seek help from a doctor, a pediatrician, preferably one who knows about enuresis. Don't, it's not a beating thing. Don't stop beating the child. Don't, it's not, stop punishing them. Stop embarrassing them. Sometimes they have no control over it, because that is what parents do. Embarrass the child, you beat them and all that. You're not solving the problem. Sometimes the child has a truly medical reason why the child is bedwetting, and the child just need the rights. And there are drugs, there are treatments. It's one of the easiest things for us to treat and to deal with. So, but you need to seek help from the right professionals. So, preferably a pediatrician, and preferably one who knows or is into enuresis. So, if you go to teaching hospital, the nephrologist will be best for you, or community pediatricians, but it depends on where you are. So, you have to make sure you get the right help. Okay, Omolara, hola, good evening. My daughter of 2 years is bringing out pus from her eyes. I think you mean PUS. Okay, that means you may have like infection, like in the eyes. Could be conjunctivitis or bacteria, it could be any of them. So you have to see the doctor. You can just clean the eyes with plain water, clean water, and maybe face towel or something, and then, but you have to see a doctor, because the child will need antibiotic eye drop for the eyes, and encourage them not to be putting their hands in their eyes, and make sure they also wash their hands often. Avila said, my 2 year, 10 months can write, good, read, speak fluently, and the best class, but having difficulty in putting words together. I don't get your pause. It sounds contradictory. Your child is speaking fluently and yet cannot put words together. That is contradictory. So your child is not speaking fluently. If your child cannot put words together, that child is not speaking fluently. That's not our understanding of a child who is speaking fluently. So a 2 year old should be speaking, at least putting two words together. Your child is almost 3, should be speaking simple sentences. That is what. So if a child is just saying words, single words, or even saying it randomly, or even repeating words after people, that is not speaking in our own understanding. I know sometimes parents can be very confused about this thing, because the child can read ABC, can recite the poems, can do all those things, but that child cannot ask a simple question like, I want bread, or I want biscuits, or something like that. So that child is not yet talking. So that child needs to see a speech therapist, okay? You need to see a speech therapist, and let the child have a proper assessment by a professional. So if you are only worried about the speech, I would say see a speech therapist. If there are other issues, I would say see a developmental pediatrician for a proper assessment of that child. So it's possible for a child to be very clever and still have a developmental diagnosis. I know sometimes parents struggle to understand how that can happen, but it's possible for you to happen together. All right. Okay. Kemi Sama says, because my 8 year old daughter, we did ECG. Okay, they told you she has tachycardia. We did echo. Nothing was found. Da, 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 da. Okay. All right. So I'm up. You already seen it. I hope you're seeing a cardiologist. Yeah. So a respiratory doctor because of the cough and breathing. Okay. Okay. All right. So you have been told between the cardiologists and the respiratory people. So somebody has to take ownership. So if the cardiologists have done their own bits and they can't find anything wrong with the hearts, then like I was telling you earlier, they want to wonder whether it's something respiratory. But it's time for somebody to coordinates everybody else. If your child is actually breathing fast and having cough and all that, then definitely it sounds more respiratory than cardiac. And obviously the cardiologist has done an echocardiography and the heart is fine. So the respiratory people have to do it and they have to take it up. Yeah, yeah, you do the x-ray. You don't need to be confused. Just relax. Let the doctors do their beds and then they will come to just relax. They will sort it out. Okay, all right. I think Avila, you put your question in the question box. I've answered it already. All right, thank you. You can ask question, but won't start conversation. So, what question is he asking? Give me an example of what your child will say. So, what when you say the child can ask question, give me an example of verbatim what the child asks and how the child asks it. Then I will tell you what I'm thinking. All right, I'll go back to Instagram, Facebook people. People always want to ask me questions last minute. All right, let's just see how much I can do before we go. Okay, I've answered 3 weeks old baby. Next question. My 14 months old is 11 kilos, is yet to walk. Okay, I took him to see Paediatrician, blah blah blah, like vitamin D, because what else can I do? Your child is, I'm not worried about your child not walking at 14 months, okay? I will start to worry about your child not walking at 18 months. So there's no reason for any vitamin D or anything. Some children don't walk until 18 months, and that is still normal. So we will start to worry if the child is not walking by 18 months. It's okay if you want to take the vitamin D and all that. I don't know whether your doctor saw whether you did a test and your vitamin D and calcium are low, but children walking is not in the bone. Children walking is not in their legs. Children walk from the brain, all right? I know that all this sounds very confusing to parents. So parents, when a child is not walking, you are looking at the legs, you're looking at the bone. That is not where children walk. Children walk from the brain. So there's a brain that gives you instructions to the legs. So we developmental pediatrician, we're looking at the brain. But like I said, at 14 months, with the time will just be a little bit slower than normal. There's nothing to worry about. If your child is not walking by 18 months, I will worry. Is your child crawling? Is your child sitting? Is this child able to stand and hold something? If the child is doing all that already, then just chillax. The child will soon walk. But if your child is not crawling, he's not standing, yes, and then I will worry. And please see a developmental pediatrician or a pediatric neurologist, not somebody who is giving you calcium and vitamin D, because the child is not walking because of lack of calcium. The child is not walking because of the legs. The child is not walking because of the brain. That is the issue. Is it normal for a baby to grunt, to scream when playing? Yes, baby do all that. If you're in Hicken, baby of 1 year, weighing 12.5. Baby, my daughter says it's too much. It's a little bit too much. Yeah, that's the weight of a 2-year-old, but it's not so bad. Some children are just a little bit on the high side. If your child not yet walking, if your child is not yet walking by 18 months again, we'll come back to that. But 12 kilos for a 1-year-old is just the upper limit of the normal. It is not like it's too, it's not going to, I'm not worried about it. Let me put it that way. It's just upper limits of normal. I don't know who is asking also like licking his leg while playing. You have to put everything you're saying together in one comment, because I won't know, I can't see your name. I'm only seeing Facebook user. So just put it together and put it with the age of your child so it makes sense. 3-year-olds have catarrh and cough. It started from birth. So you mean the child has had cough and catarrh for 3 years, all its life. You need to see an ENT doctor. All right. So if your child has had cough, catarrh every day of his life for 3 years, you have to see an ENT doctor urgently. But I don't believe your child has cough and catarrh for 3 years. I guess you meant the child is having it on and off, on and off. But all the same, you can either see a pediatrician or you can see the ENT doctor to know why the child is having recurrent cough and catarrh. Sorry, my laptop is not touch screen. Okay, so my baby of 3 months old poo is like ogbono slimy with a lot of egusi. That is normal stool. Please breastfeed your baby exclusively. Uh, uh, the, 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 I realized I want bread, I want tab, I want drink juice, I want to eat biscuits and all those. Last week was sleeping, her phone was blowing, so he got up and asked his daddy, "What is this?" Pointing at the fan, and his daddy responded, "What is this?" Okay, yeah. Um, what is this? Okay, so if your child is asking questions, um then I'm wondering why you're worried. You see, as a mother, I know that mothers always have intuition when something is not right. You just know something is, you just know, even when you're struggling to communicate it to me, like you know what you're doing now. Because the question I'm asking myself, that if your child is saying, "I want this, I want that, what is this, what is that," then why are you worried about your child not putting words together? Because that looks like a child who is putting words together for me, because that is like three words together. But you are the one that also said your child is not putting words together. So it's like you keep giving me information that seem to be contradictory. Okay, so that is why I'm worried, and that alone worries me. The fact that you are giving me information that on one hand it seems like everything is fine, and on the other hand you are still worried about your child. That alone worries me, because usually parents will only worry when there's something, and 90% of the time mothers have it. You're right. So I will still say, see a speech therapist first. If they see the child and they are happy, then at least you relax, your mind will be at rest, so that a professional have seen your child and the professional is not worried. So okay, but if the professional is worried, then that is when um we'll tell you what next to do. Okay, obviously if you're a first time mom, yeah, it's possible you may not know what is normal or what is expected for a 2-year old. So if a 2-year old is saying, "I want this, I want that," or "What is this?" that is normal for a 2-year old for me, and I won't be worried. But I worry that you are worried. Then the question I want to ask is that, are there other people who have raised concerns about your child? That are there other, maybe I don't know where your child is going to a crèche or nursery? Have those people in those places also telling you they're worried? If they are, then that is also a significant thing. But if they are not worried, then I'll just say just leave it. So, but if you're worried, there's nothing wrong in seeing a professional. At least the best they will do is to reassure you. All right, so my time is up. I gotta go. But like I said, if you still have any question, feel free to put your question on our Facebook group from Mondays to Saturday. And this Saturday, 27th of May, is our outreach online. So myself, my colleagues will be here online to answer your questions. I mean, to do one-to-one consultation for free. It's going to be 10 minutes consultation per child. So the link is on all the platforms. Click on the link, book in, and we will get back to you on. So we it's going to run from 9 to 5. So different doctors at different time, and we have many of us, so you will see at least one doctor if you book in. So the earlier the better, because we'll soon close the link, because we have only limited slots. Remember, it's 9 to 5, and we can only see one child for 10 minutes. So you can work out the maths. So, and it's going to be first come, first serve according to how you book. But we hope to see as many of you as possible. We'll just take the last two questions and then I'll go home. My son has this red mark at the back of his head from birth. It may be a birthmark, but send a picture to Facebook group. I will have a look at it and I will tell you whether it's a normal birthmark. And most time, anything that present from birth, most time they are part of the child. But then I always worry when you see those things. Why don't you ask your doctors where your baby was born? Every child must be examined by a doctor when they are born, so that they can pick up anything and then they can address it. So it's very important that when your child is born, a pediatrician should examine. Even if it's not a pediatrician, at least one doctor should have a look at the baby and tell you everything. And even if you go home and you see something, go back and ask them, this thing I'm saying, what is it? That is the job of the doctors. My okay, so last question. My 4-year-old has allergy to milk, blah blah blah. Da da da. What other things can I give us to complement the milk? She's like, so if your child is allergic to milk, the child is allergic to something in the milk. So there are different kind of milk. So if your child is, for example, is allergic to cow milk, you may want to do non dairy milk. You may want to do things like coconut milk or almond milk. You may want to do other kind of milk that your child may not be allergic to. But the best option is to see a doctor first, and then they can give you alternatives. You know, most important is that your child is getting access to calcium and all that. Sometimes we just have to put your child on medication for that. So, but you can always get alternatives. So the most important is to know what is it in the milk that the child is allergic to. If it's the cow milk protein, then we can try other milk that are not cow milk. We can try plant-based milk. That may be the other alternatives. All right. Somebody said, can a 10 weeks old baby stop up to 80 meals? Yes, the baby can. All right. Thank you, ma'am. I'll see you on Saturday. You won't be here on Saturday. You have to go book. Click on the link. If you look for the comment that I dropped, just scroll up. You will see the comments I dropped. You click on the link and you register, and we'll be in touch with you for the consultation. So that is how it's going to be on Saturday. So it's not going to be on Instagram, it's not going to be transmitted live. It is a private consultation, one-on-one with each of the pediatricians. But I'll be here on Thursday, and I'll be talking about the health of our children, how we can maintain good health for our children as we celebrate the Children's Day. And please, on Saturday, help me to celebrate all my children. Help us to give them a treat, take them out, give them make them feel loved and celebrated. And we will be there in the background doing all the consultation for free. At least we hope to do over like 200 consultations free that day. So I'll see you next week by God's grace. And I'll see some of you on Saturdays during the free consultation as well. Thank you so much for watching, and have a wonderful evening. Bye, everyone. Bye.